Ear piercings have evolved beyond the traditional lobe, offering a canvas for personal expression through various placements. Let's explore the different types of ear piercings, their locations, pain levels, and healing times. Standard lobe piercing. The standard lobe piercing is located on the soft, fleshy lower portion of the ear. Its pain level typically rates 2 to 3 out of 10 on pain scales, with a healing time of 6 to 8 weeks. This piercing accommodates various jewelry types, including studs, hoops, and dangling styles. Due to its straightforward healing process and versatility, the standard lobe remains the most common ear piercing. Stacked lobe piercing. Stacked lobe piercings consist of multiple perforations positioned vertically on the earlobe, creating a linear arrangement. The pain level remains at 2 to 3 out of 10, 2 to 3 out of 10, with each approximately 6 to 8 weeks. This configuration allows for creative jewelry combinations while remaining in non-cartilaginous tissue. High lobe piercing. The high lobe piercing is positioned on the upper portion of the earlobe just before cartilage begins. Its pain level averages 3 out of 10, with a healing time of 8 to 10 weeks. This placement serves as an anatomical bridge between the lobe and cartilage regions of the ear. Transverse lobe piercing. A transverse lobe piercing passes horizontally through the earlobe rather than from front to back. The pain level measures 4 to 5 out of 10 due to the extended piercing channel, and healing requires 10 to 12 weeks. This piercing necessitates sufficient earlobe thickness and typically utilizes straight barbell jewelry. Stretched lobe piercing. The stretched lobe involves gradual expansion of a healed lobe piercing to accommodate larger gauge jewelry. The process requires incremental stretching, typically 1 millimeter increases with adequate healing time between stretches. When performed correctly, stretching creates pressure sensation rather than pain. Jewelry options include plugs, tunnels, and eyelets. Helix piercing. The helix piercing perforates the upper outer cartilage rim of the ear. Its pain level registers at 5 to 6 out of 10, with a healing time of 6 to 12 months. Initial jewelry typically consists of straight barbells or labret studs to minimize movement during healing, though rings can be worn after healing completion. Double triple helix piercing. Double and triple helix piercings comprise multiple perforations along the helix rim. The pain increases incrementally with each additional piercing, 6 to 7 out of 10, and healing multiple simultaneous piercings extends to 9 to 12 months. The anatomical structure allows for varied spacing and jewelry combinations. Forward helix piercing. The forward helix piercing is positioned on the anterior portion of the helix, where the cartilage connects to the face. Its pain level ranges from 6 to 7 out of 10, with a healing time of 6 to 9 months. The location's proximity to facial movement and potential contact with communication devices requires specific aftercare considerations. Vertical helix piercing. A vertical helix piercing traverses the helix rim vertically, rather than horizontally. The pain level matches standard helix piercings, 5 to 6 out of 10, but healing extends to 8 to 12 months due to the non-standard angle. Curved barbells conform best to this orientation. Flat piercing. The flat piercing penetrates the flat plane of cartilage between the helix and anti-helix. Its pain varies, 5 to 7 out of 10, depending on precise placement, and healing requires 6 to 9 months. The flat surface anatomy dictates jewelry selection, with flat-back labrets being anatomically appropriate. Industrial piercing. An industrial piercing consists of two cartilage perforations connected by a single straight barbell, typically linking the forward helix and standard helix. The pain level rates 7 to 8 out of 10 due to the dual perforation, and healing time extends 9 to 12 months minimum. This piercing requires specific anatomical projection to accommodate the connecting barbell. Inner conch piercing. The inner conch piercing penetrates the central depression of the ear's cartilage, parallel to the daith. Its pain level measures 6 to 7 out of 10 due to cartilage thickness, and healing requires 9 to 12 months. The recessed location accommodates studs and flat back labrets optimally. Outer conch piercing. The outer conch piercing is positioned in the lower conch region near the anti-helix. Its pain level registers at 6 to 7 out of 10, with a 9 to 12 month healing time. The anatomical location allows for both stud jewelry and large diameter rings that follow the ear's contour. The rook piercing traverses the anti-helix fold above the ear canal. Its pain level rates 7 to 8 out of 10 due to cartilage density in this region, and healing extends from 9 to 12 months, sometimes requiring up to 18 months for complete healing. The anatomical structure accommodates curved barbells and small diameter rings. Faux rook piercing. The faux rook piercing is placed on the flat cartilage surface above the rook fold rather than through the fold itself. Its pain level measures 5 to 6 out of 10 with a healing time of 6 to 9 months. This placement creates a visual effect similar to the rook while utilizing different anatomical structures. Daith piercing. The daith piercing perforates the innermost cartilage fold crus of the helix above the ear canal. Its pain level rates 7 to 8 out of 10 due to cartilage thickness and the challenging angle. Healing requires 9 to 12 months, potentially extending to 18 months. The anatomical structure naturally accommodates ring-style jewelry. Snug piercing. The snug piercing passes through the anti-helix ridge between the outer rim and inner conch. Its pain level registers at 8 to 9 out of 10, with a healing time of 12 to 18 months. The thick cartilage and pressure points in this location contribute to its extended healing period. Tragus piercing. The tragus piercing perforates the small cartilage projection partially covering the ear canal. Its pain level measures 6 to 7 out of 10, and healing requires 6 to 9 months. The anatomical location may temporarily affect the use of in-ear headphones during the healing period. Anti-tragus piercing. The anti-tragus piercing is located on the cartilage projection opposite the tragus, just above the earlobe. Its pain level rates 7 to 8 out of 10 due to cartilage density, and healing time extends to 9 to 12 months. The anatomical structure accommodates curved barbells and small diameter rings. Orbital piercing. The orbital piercing utilizes two perforations connected by a single ring, creating a circular path through ear tissue. Its pain and healing vary by location. Lobe orbitals, 3 out of 10, 2 to 3 months, versus cartilage orbitals, 6 to 7 out of 10, 9 to 12 months. The dual perforations must align precisely to accommodate the connecting jewelry. The auricle piercing is positioned on the outer cartilage rim between the helix and lobe. Its pain level averages 5 to 6 out of 10 with a healing time of 6 to 9 months. This intermediate location bridges upper and lower ear anatomy. Forward helix piercing, single, double, or triple. Forward helix piercings consist of sequential perforations along the anterior helix region. The pain increases with each additional piercing, 6 to 8 out of 10, and healing multiple simultaneous piercings requires 9 to 12 months. The anatomical position provides frontal visibility compared to other ear piercings. Surface custom piercings. Surface and custom piercings utilize non-standard locations on the ear's surface rather than through edges or folds. These piercings employ specialized jewelry such as surface bars or microdermal anchors. The pain varies 5 to 8 out of 10 based on placement, with healing requiring 6 to 12 months. Surface piercings have higher migration and rejection rates due to their non-standard placement. Vertical tragus piercing. The vertical tragus piercing traverses the tragus vertically rather than horizontally. Its pain level measures 7 to 8 out of 10 due to the non-standard angle and limited tissue space. Healing requires 9 to 12 months. This orientation necessitates curved barbell jewelry and specific tragus anatomy. Transverse helix piercing. The transverse helix piercing passes horizontally through the helix rim rather than from front to back. Its pain level rates 7 to 8 out of 10 with a healing time of 9 to 12 plus months. This orientation requires sufficient helix width and utilizes straight barbell jewelry.